welcome to The Doctor Is In. I'm Dr. Freddie Gomez, and while you stay safe at home, we are here to provide you with the medical questions, with the medical answers to your questions and concerns when it comes to COVID 19. So, we've been under this months now, and we COVID 19 not only affects our bodies, but it affects important public health services. So these include health services such as vaccination and immunization and the proper implementation of these. So today, we'll discuss gaano ba kaimportante ang pagbabakuna, gaano ka ba kaimportante ang pagkontrol ng mga parasitic infections like deworming, and alamin natin ito kung paano pa rin ito makakapagpatuloy even though nasa pandemya po tayo. So, today we are joined by Dr. Maria Wilda Silva. She is the National Immunization Program Manager for the Department of Health. Welcome to the show, Dr. Silva.
Thank you, Dr. Freddie, and good afternoon to everyone.
Yes, good to have you here. So as we deal with this pandemic, Dr. Silva, napakaraming epekto nito sa buhay natin. A lot of people know that. So it affects even the delivery of primary health care services, just like immunization. So, Dr. Silva, can you explain to us why is it so important that these programs like immunization and vaccination continue? Let's start first kung ano ba yung mga posibleng sakit na pwedeng maiwasan kung ang mga tao, lalo na yung mga kabataan, ay kumpleto sa bakuna?
Napakarami kasi tayong vaccine-preventable diseases na pwedeng makuha kapag hindi protektado or kompleto ang ating protection against this vaccine-preventable diseases. Isa na dyan ay ang polio. Isa ring halimbawa ay ang measles or ang tigdas, which actually we are having a very hard time controlling the transmission of these two diseases. The National Immunization Program since 1978, nagbibigay na siya ng libreng bakuna para sa ating mga under 1-year-old children. And we also acknowledge na dahil po dito sa ating COVID-19 pandemic, our routine immunization program really suffered disruption or experienced disruption in the service delivery. So, isa-isahin natin ang mga vaccine-preventable diseases natin. At birth, we are giving 2 types of vaccine. One against tuberculosis, this is the BCG, and one for hepatitis B. And then as the child ages, meron tayong binibigay for pneumonia, for meningitis, for polio, for diphtheria, pertussis, and tetanus. At ito binibigay natin simula pa lang na 6 weeks ang bata for 3 doses, 1 month apart. And lastly, before the child reaches 1 year old, kailangan siyang makakuha ng 2 doses of measles-containing vaccine. One is given at 9 months, and the second dose is given at 12 months. So all of this in the routine immunization program, kapag ka nakompleto mo, ito yung sinasabi natin na fully immunized child ka in the definition of the public health immunization program. Because as you know, in the private sector, may mga iba pa rin naman silang mga bakuna na ibinibigay sa ating mga under 1 infants and children na hindi nakasama sa ating routine immunization program na binibigay ng libre ng ating pamahalaan. And yes, napaka-importante that these vaccines will be received or will be given to the infants sa tamang schedule. Why tamang schedule ang aming ine-emphasize? Because there are diseases na talagang common siyang makuha ng ating mga kabataan. And the goal of the immunization program is bago ka man lang makasagap ng mikrobyo, ng viruses that will cause these vaccine-preventable diseases, ay nagkaroon ka na ng protection sa pamamagitan ng pagtanggap ng bakuna, complete doses at nasa tamang schedule.
That's right. So to the parents, take note of this very important information. So COVID-19 is not the only thing you should be looking out for, as there are other infectious diseases out there. So always remember that prevention is better than cure. Now let's answer some social media questions. We have one from Miguel. Ang tanong ni Miguel, vaccine lang po ba ang paraan para makaiwas sa polio?
Napakagandang tanong yan. Yes,
What do you think, Dr. Silva?
Yes, vaccine is the best protection that we can give our children against polio. Pero kaakibat nito, hindi natin pwedeng isawalang bahala ang kalinisan ng kapaligiran at kalinisan or personal hygiene. You know that polio is transmitted sa via oral, no, fecal oral route. So kung hindi maganda ang ating personal hygiene at hindi tayo naghuhugas ng ating mga kamay bago tayo kumain after using the toilet, then chances are we can have this inside our body, itong poliovirus na ito. Subalit kung ikaw ay fully immunized or fully protected, you have at least 3 doses of the oral polio vaccine, as well as 1 dose of the inactivated polio vaccine, then magiging protektado ka. Pero, okay, merong disclaimer. Hindi po natin kailangang isawalang bahala ang environmental sanitation and personal hygiene. Kaakibat to sa pagkontrol natin ng mga nakakahawang sakit, just like polio, measles, and even COVID-19.
That's right. So it's also important to coordinate with your barangay health workers to know the schedule of your vaccination. Thank you very much, Dr. Maria Wilda Silva, for discussing all of these, including that very important schedule of vaccinations with us today.
Thank you. Thank you as well.
Okay, so we need to take a short break, but when we return, we'll talk about the importance of deworming and how this disease, this parasitic disease, affects our health. Stay tuned to the Doctor's In. I'm Dr. Freddie Gomez, and you're watching CNN Philippines. So we continue to answer your questions with regards to COVID-19. And to continue this discussion, we will now be talking about deworming, or sa Tagalog, ang pagpupurga. So this parasitic worm infection is quite common, lalong-lalo na sa mga kabataan. So to raise awareness on this matter, we are joined by Dr. Cristina Ignacio-Alberto, who is a pediatrician and part of the Philippine Pediatric Society. Welcome to the show, Doctor.
Good afternoon, everyone.
So as July is National Deworming Month, the Health Department is conducting deworming programs in communities to eliminate intestinal parasitism in children. So, Dr. Tina, could you share with our viewers the importance or the significance of controlling this type of infection?
Okay, so ano po ba yung problema natin at ganong kalala ba ang problema natin sa intestinal parasitism, no? Among children kasi this is one of the most neglected problem kasi hindi natin siya nakikita, hindi natin naalalaman na napakalaki ng effect niya sa health. Okay? Around the world, around 870 million kids are infested. Among Filipino children, 6 out of 10 Filipino child ay may intestinal parasite, and this greatly affects the nutrition and the health status of the child. Children with intestinal parasitism can get anemia, micronutrient deficiency, tapos they are stunted. They gain poorly in terms of height and weight, which later on can affect their mental development, pati yung school performance. So it's very important that we comply with the deworming of the Department of Health and our doctors. So in the Philippines, we do our deworming twice a year. So this is done in January and in July. And ang nagsispearhead ng program for deworming is the Department of Health. But the private sector, me being part of the private sector, we do our job by also encouraging parents to go to the health centers and to get their deworming medicine. So it's very important that kids get dewormed because this has very great implication on their health and their development as a whole.
That's right. So, and one big factor of this is poor sanitation and not so clean surroundings. So this is one of the big factors that contribute to getting infected. Ano? So iba't ibang klase ng parasitic worms ang maaring nating makuha sa lupa. Kaya first is you must not walk around barefoot. So going back to our discussion, ano naman doctor ang mga sintomas ng posibleng sakit kapag ikaw ay infected ng intestinal or parasitic worms?
Okay. Sa mga bata, sometimes they manifest muna with abdominal pain. They will complain of abdominal pain. Sometimes some children will have nausea, vomiting, diarrhea, and sometimes also kids will get anemia. Kaya pala walang ganang kumain, irritated, poor ang school performance, pala hindi siya nakakapag-concentrate sa school because of the nutritional deficiency. And sometimes also, the most severe case I've seen is death because of intestinal parasitism because the patient got intestinal obstruction. So, napakadaming komplikasyon ng intestinal parasitism at hindi lang to simpleng problema. So, dapat talaga as parents, we all should deworm our children biannually or twice a year to avoid intestinal parasites.
That's right. So aside from illnesses, these parasites can also affect your child's growth and development, like what Doctor mentioned earlier. So kahit ang performance niya sa school ay maaaring maapektuhan. Kaya bago ito mangyari, it's important to monitor your child's activities in order to minimize the risk for infection. Now let's check some of the questions that you posted online. Meron tayong tanong na galing kay Roxy. Ang tanong ni Roxy, mga bata lang ba ang at risk sa parasitic worms?
Actually, hindi lang po mga bata ang at risk for parasitic worm. Your hookworm, for example, pumapasok po sila pag tayo naglalakad ng barefoot sa karsada or sa lupa. So even adults who are walking barefoot dun sa karsada, you can get this also. And if we tend to eat raw food, raw vegetables, raw meat, we are also at risk for getting infection. And of course, yung mga handlers ng pets, ng aso, ng pusa, this also contains intestinal parasites. So kailangan dinideworm din po ang ating mga alagang pets. Ano? So even adults are also at risk for the same infestation, and even adults who are at risk should get also their deworming biannually.
Okay, so there you go. You got it from the doctor herself. Now we have another question from Kathleen. Ito, medyo connected, doctor, dun sa sinagot nyo, no? Can these worms live in the food we eat? May mga pagkain na nakukuha rin sa lupa na makontaminate ito ng mga bulate.
Yes. Oo, yung mga pagkain natin doon usually nakukuha rin yung mga worms. Ano? For example, yung mga vegetables like your lettuce or cabbage, kung hindi po natin ito huhugasan ng mabuti prior to preparation or eating, we can get the eggs. Kasi ang eggs po, hindi natin nakikita yan. It's not visible to the naked eye. So when we ingest it and we don't properly clean it, pwede po tayong ma-infect. And even your meat, no? Your meat, your liver, your meat, your sardines, your fish can sometimes also contain worms. At kapag hindi po natin to niluto ng maayos at raw pa po at hindi pa masyadong luto ay kainin natin, we can also get intestinal parasitism from it. Kaya nga dapat yung safety habits natin in terms of food preparation, dapat hindi po natin kinakalimutan. Okay? Even adults are at risk for getting intestinal parasites.
Okay, so tuloy-tuloy ang discussion natin with Dr. Cristina kung gaano kahalaga ang deworming process. But first, we have to pause for a quick break. We'll be right back on The Doctor's In. Welcome back to the Dr. Zin. I'm Freddie. Infection pa rin ang
ibang sakit. So as we continue with our discussion, let's talk about how this kind of infection can cause malnutrition. Joining us is pediatrician Dr. Cristina Ignacio-Alberto to tell us more about this. So doctor, a while ago we talked about how these types of worms can cause diseases. Ngayon, paano naman ito nagdudulot ng malnutrition?
Okay. So, paano nagdudulot ang worms ng malnutrition? When we are infested with parasites, okay, this interferes with nutrient absorption. So, lahat ng nutrition na dapat napupunta sa bata, sa worm napupunta. So, we get anemia, we get nutritional deficiencies. Kaya yung mga bata, yung weight gain nila, hindi natin nakikita, no? Kumakain pero hindi tumataba. At the same time, chronically, pag na-infest ang bata, yung height nila naaapektuhan din. At the same time also, intestinal parasites can also cause internal bleeding or hemorrhages. So these hemorrhages can also lead to severe anemia in children. So this is the most common explanation kung bakit ang mga bata are really chronically malnourished when they are not dewormed. So very important po talaga we do deworming in our children every 6 months.
Okay. Now, Doktora, para dun sa mga viewers na a deworming procedure, never even thought about it before, tell us how deworming works. At tuwing kailan na ito dapat gawin, like what you said earlier. Remind natin ulit ng mga viewers.
Para hindi nalilimutan ng mga viewers natin ang pagdi-deworm po under the Department of Health. Although I'm not part of the Department of Health, we do it January and then July. So that's every 6 months. So sa health center, what we give out is albendazole 400 milligram or mebendazole 500 milligram tablet. So ito po ay chewable tablet. So ang mga bata 1-year-old to 14 years old are given free medicine care of our health center. At ito po ay dinuduro kung hindi pa po marunong lumunok o umuya ang bata at pinapainom kasabay ng tubig. Sa mga magulang, wag po kayong mag-alala sa side effect ng mebendazole. This is very poorly absorbed sa intestine. Meaning, ang naaapektuhan niya lang po ay ang mga bulate sa bituka at hindi naaabsorb sa sirkulasyon. Thereby, medyo kakaunti lang po talaga ang systemic side effects niya. So kung yung weigh po natin yung risk and benefit of getting the medicine, mas mataas po talaga ang advantage or benefit of taking mebendazole every 6 months for all our children from 1 to 14 years old and for adults who are at risk of getting worms.
Okay, very good information para at least para sa peace of mind ng mga magulang na very helpful ang mga gamot na ito para sa kalusugan ng mga bata. Okay, now let's answer some of the social media questions posted on the CNN Philippines Facebook page. So we have a question from Patricia. Ang tanong ni Patricia, bukod sa deworming, ano po ang best way para makaiwas sa parasitic worm infections na ito?
Okay. So number one, gaya na sa polio na sabi ni Doktora kanina, one is hygiene and sanitation. Okay? Una sa lahat, kailangan yung community talaga nagpa-practice ng good hygiene. Lalo na yung mga poor communities na walang mga palikuran o CR, dapat the government should provide adequate water supply and mga malilinis na comfort room sa mga lugar na ito. Sa atin namang mga kabahayan, turuan natin yung mga bata na before eating, kailangan naghuhugas muna ng kamay bago tayo kumain para naiiwasan ng bulate. Ikatlo, kailangan din na dapat hindi po natin sila pinaglalaro ng walang tsinelas or sa sapatos sa labas ng bahay. Ikaapat, siguraduhin na uminom lamang ng malinis na tubig. So iwasan po ang uminom ng tubig na marumi o hindi po purified kasi po ito ay maaari magdala ng worms. At ikalima, of course, proper handling ng ating food. Food safety should always be practiced. Always cook it well and rinse it before eating it.
Very good. Cleanliness really does go a long way. Okay, now we have another question from Lawrence. Ang tanong ni Lawrence, are there ways to deworm myself from home?
Actually, yes. If you have a private doctor, you can go to a private doctor for a prescription of your anti-deworming, which is your mebendazole. At ngayon po ang ating mga health center, bukas pa rin po sila. They are providing free medicine for deworming. So any day, I've asked our local health center, they're open every day and you can get your free medicine sa ating local health center. So ang July po, ang tamang buwan ng pagpupurga para hindi po natin malimutan.
Okay, very good. And for our viewers, wag po magbaka sakali. Always check with the doctor in case you want to take in some medicines or to do something like this, like deworming. Okay, so wag po agad-agad umasa sa internet for that. It's best to talk to a doctor yourself. Now, lastly, sagutin natin ang tanong ni Crystal Alexa. If you suspect this kind of infection and my son starts to have diarrhea, what first aid tips can you give?
Okay. So first aid tips, of course, when you have diarrhea, oral rehydration solution. Okay. So if you're a breastfeeding mom, continue your breastfeeding. If you are not breastfeeding, then you can either buy your prepared oral rehydration solution or pwede rin tayo mag-prepare sa bahay gamit po ang malinis na tubig, asin at konting asukal. So, and also you have to increase oral fluid intake of your child and also support the feeding of your child. Kung nagsususpecha po kayo na yun po ang dahilan, hindi po tayo basta-basta pwede mag-deworm because sometimes your deworming sa panahon ng pagsusuka ay maaaring mag-trigger lalo ng severe abdominal pain and diarrhea in children. So, pumunta po sa pinakamalapit na doktor, malamang liresetahan po kayo niya ng oral rehydration solution at mga supportive medications for diarrhea. And then of course, you have to do your stool exam para po masigurado natin na ito po ang sanhi ng pagtatae at hindi po ibang dahilan. Kasi napakadami pong sakit na maaaring maging dahilan ng pagtatae.
Okay, before Cristina, could you please remind our viewers again the importance of all of this and to be clean with their surroundings?
Okay. So sa ating mga viewers, importante po para po maiwasan ng deworming, tandaan po natin ang dalawang panahon kung kailan tama nagdi-deworm. June at July ang national period ng deworming sa buong Pilipinas. May libre po tayong gamot sa health center. And of course, hindi po natin masusolusyonan ang problema sa worms kung hindi po natin pananatilihing malinis ang ating lugar. So tama po mag-practice tayo ng safety and hand hygiene at ang tamang sanitary practices gaya ng paggamit ng tamang CR at paggamit ng malinis na tubig sa ating pag-inom. Okay? So, yun po ang ating dapat na safety practices. At sa mga pet owners, mahalaga din po, always bring your pets to their veterinarian for proper deworming also dahil kayo rin po ay at risk for intestinal parasitism.
Thank you very much, Dr. Tina, for shedding light on this topic and joining us today on The Doctor Is In. And I'd like to thank also our viewers for joining in and sharing your questions on the CNN Philippines Facebook page. We hope that today's show serves a reminder that there are other diseases aside from COVID-19 and we must always, always be careful. So let's stay strong and healthy and always be aware of health programs available to us. I'll see you again tomorrow at 3:30 p.m. here on The Doctor Is In. Take care, everyone.